Good afternoon, everybody. Thank you for joining us, and apologies for the slightly late start. We've been having some technical difficulties which may recur over the course of today's briefing, so if that's the case, my apologies in advance. Let me begin with today's statistics. The total number of positive cases reported yesterday was 2,309. That is 8.1% of the total number of tests, and it means that the number of confirmed cases now stands at 146,024. 692 of today's new cases were in Greater Glasgow and Clyde, 390 in Lanarkshire, 220 in Lothian and 192 in Grampian. The remaining cases were spread across the 10 other health board areas. I can also confirm that 1,530 people are currently in hospital, which is an increase of 63 from yesterday. This now does exceed the peak of April, when we had 1,520 COVID patients in hospital at any one time. So that really does underline the severity of the pressure that our hospitals are currently facing. 102 people are in intensive care. That is 2 more than yesterday. And very sadly, 93 additional deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. And that takes the total number of deaths under the daily measurement to 4,872. Every single one of those deaths is much more than a statistic. Every single one is a unique and irreplaceable individual. And yet again, I want to convey my condolences and my thoughts to everyone across the country who is grieving the loss of a loved one at this time. I'm joined today, as you can see, by the Chief Constable and by the National Clinical Director. The Chief will say a few words shortly about Police Scotland's approach to the new restrictions and also a word about the safety of vulnerable people. Before that, though, there are some issues I want to briefly update you on, and the first of those concerns international travel. The risks of international travel are, of course, particularly acute at the moment as new strains of this virus emerge and as case numbers globally continue to increase. Indeed, that's why it is, as of now, illegal for anyone to travel to or from Scotland unless it is for an essential purpose, and I want to reiterate that point. Right now, you should not be travelling within Scotland, and you should not be travelling out of Scotland or into Scotland for anything other than an essential reason. Even with such a reason, anyone who is travelling to Scotland must still comply with quarantine requirements if they are coming from a country that is subject to those requirements. Last night, the Scottish Government, along with the UK Government, announced a further measure aimed at reducing the risk of importation of the virus. People travelling to Scotland from overseas will be required to present a negative COVID test result before they embark upon their journey. We are currently working with other parts of the UK to confirm the exact start date for this new requirement, but it is likely to be from the end of next week, and we'll set out that and further details as soon as possible. The tests will require to be highly reliable in terms of their specificity and their sensitivity, and so in practice they are likely to be PCR tests, and they will be required of anyone travelling to Scotland from outside of the common travel area, and they will need to be taken no more than 72 hours before people start travelling to Scotland. It's important to stress that the tests will not replace existing quarantine requirements. They are in addition to those quarantine requirements. So anyone travelling to Scotland from a place which is not on our exemption list will still have to isolate for 10 days after they arrive. There will be a limited number of exemptions to this new testing requirement, for example, for younger children and for freight hauliers, but a full list of these exemptions will be set out when we set out the further details of how the scheme will operate. In addition, we also announced last night a number of changes to the list of countries that are subject to the quarantine requirements. This includes extending the extra restrictions on travel from South Africa to a number of other countries in the region. These restrictions will remain in place as we await findings of further analysis from UK and South African scientists on the impact of the new variant that has been identified there. And again, the full details of countries affected and also of the new restrictions can be found on our website. However, the most important point I want to emphasise is the one I made at the start. These restrictions on quarantine and testing It really shouldn't apply to very many people, because nobody should be travelling to or from Scotland right now unless there is a genuinely essential purpose for that, and I cannot stress that key point enough. Now, my second update for today is about the return of our colleges and universities. When I set out the new lockdown restrictions on Monday, I said then that we would be reviewing as a matter of urgency the arrangements for the start of the new term. I can confirm that the staggered return to term time accommodation and studies for students, which had been planned for since the end of last term, will now be extended. For the vast majority of university students, learning and teaching will be online only until at least the end of February. And that means if you're a student, you should stay at home rather than travelling back to your campus or term time accommodation. There will be exceptions to that in the very small number of cases where remote study is not possible, for example, for a student nurse or a doctor on a practical placement. And of course, any students who have remained on campus will be fully supported by their institution. However, the vast majority of university students should stay at home rather than travelling back to university, and should be learning online over the next period. And as most of Scotland is now, of course, in level 4 restrictions, the vast majority of college students will also continue to learn online. Specific advice about the arrangements for online learning and the restart of in-person teaching will be provided by your college or university, but more general guidance will be published on the Scottish Government's website over the next few days, and we will, of course, continue to keep these arrangements under close and ongoing review. I know how deeply disappointing this news will be for students across the country, and I can't tell you how sorry I am for this continued disruption to your learning and to the whole experience of university and college life. It's not yesterday, but I remember vividly the importance of these university years, and so I feel bitterly disappointed on your behalf that they are being so disrupted. But let me assure you that these decisions are not ones we take lightly. They are in the interest of keeping you safe and keeping the country as a whole as safe as possible. So thank you for your understanding and cooperation. The third point I want to make is one that I know the Chief Constable will also touch on in his remarks, and that's about the impact of the pandemic on victims of domestic abuse. We know that during a period of lockdown, there's a very real risk that those who are already experiencing domestic abuse will feel especially isolated and vulnerable. So I want to take this opportunity to emphasise a few really important points. Firstly, the lockdown restrictions do not prevent you from leaving your home if you are escaping domestic abuse or if you're taking other measures to protect yourself. Secondly, Police Scotland will respond to every report of domestic abuse, and they are continuing, as I'm sure you'll hear from the Chief Constable, to treat this issue as a priority. And finally, please remember there is other help available. Over the past year, the Scottish Government has provided additional funding for support organisations such as Scottish Women's Aid and Rape Crisis Scotland. And as a first point of contact, you can call the Domestic Abuse and Forced Marriage helpline, and I'm going to give that number in a moment. The helpline remains fully operational 24 hours a day, 7 days a week. So if you need help, you can email or web chat through the website, or you can call 0800 027 1234. That's 0800 027 1234. Fundamentally, it's unacceptable that for some people home is not the place of safety it should be. So for anyone who is experiencing domestic abuse, I want you to know that services are still open and urge you to seek help. Now, before I conclude, let me just remind you that a number of restrictions that were announced earlier in the week have come into force today. Sadly and hugely regrettably, places of worship are now closed except for the purposes of broadcasting a service or conducting a funeral or wedding, although these too are subject to restrictions. And a number of non-essential services are also now closed. These include snow sports centres, showrooms of larger retailers and clinics offering cosmetic and aesthetic procedures. As I indicated yesterday, we are reviewing whether any further restrictions are necessary to maximise the effect of this lockdown. But to be clear, the country is now in lockdown. Every single one of us must play our part in slowing down the spread of this virus, reducing the number of people who get infected, while the vaccination programme starts to have an impact. And the best way of doing that is to stick to the new lockdown rules. Please stay at home. Only leave your home for essential purposes, caring responsibilities, essential shopping and exercise. Outdoors, you can only meet with one other person from one other household at a time in groups of no more than 2. Work from home if you possibly can. That's now the law. And a message again to employers. If your staff were working from home in the lockdown last spring, they should be working from home now. And please make sure that they are enabled to do so. And finally, if you are out and about, remember facts. Remember to wear face coverings. If you are, for example, out doing essential shopping, avoid anywhere that is busy, clean your hands and clean surfaces regularly. Use 2-metre distancing if you are talking outdoors to someone from another household, and self-isolate and get tested if you have symptoms. On any occasion when we're outside our homes, these measures are still effective to break the chains of transmission of this virus. But fundamentally, the best means right now of protecting ourselves and those we love is not to go out unless we have an essential reason to do that. Staying at home is how we stay safe and protect our loved ones and our communities, and give the country time to get the vaccination programme motoring in the way that we intend it to do. So please stay at home, protect the NHS and save lives. That's the fundamental message I am asking everybody to heed and help us spread to everyone across the country. Thank you again to everyone for listening and for your cooperation and sacrifice. I'll now hand over to the Chief Constable before I and Jason take questions as normal. Chief.
Thank you, First Minister. Good afternoon. As the First Minister has outlined, and as all of us are now aware, vaccination now provides us with a route out of this pandemic. However, cases are rising steeply and rapidly, and everyone must continue to do the right thing. Collectively, we all play our part to protect life. Now, right now, that means one key thing: staying at home, unless being outside of your home is for an essential purpose. This is a critical time in the country's response to the pandemic. Now, to support the public health imperative, as Chief Constable, I will maximise policing's visible presence in our communities and on our roads. I'll do that to help people, to offer reassurance, but also to act as a deterrent to those who may be thinking of breaching restrictions. Although the restrictions have changed again, and they're very strict, as they have done often, and indeed at times quickly, the approach of Police Scotland will not change. Our response has been and will remain proportionate, reasonable and fair, underpinned, of course, by the principle of consent, from which we draw our legitimacy. Officers and staff overwhelmingly discharge these new responsibilities and duties with compassion, common sense, explaining the rules, helping people to do the right thing. But be assured, be very, very clear, where officers encounter willful and blatant offences, we will continue to act decisively to enforce the law as the public would expect. Since the pandemic commenced back in March, officers across Scotland have had over 100,000 interactions with their fellow members of the public regarding coronavirus compliance. We've issued over 7,000 fixed penalties and made almost 550 arrests. In addition to that, we've made over 350 interventions at different premises, and we've closed about 90 of them. Communities have demonstrated forbearance when asked to cooperate with the extensive necessary restrictions on personal liberty, personal freedom. Our experience over the last 10 months is that overall, the people of Scotland have shown overwhelming support for their police service during this pandemic. So it's important for me to say on behalf of policing, thank you to our fellow citizens for taking responsibility in supporting officers and staff, and ask that in this new lockdown, the support and that sense of personal responsibility continues. And of course, officers and staff themselves face the same professional and personal challenges as everyone in the country. So I thank them and their families for their commitment to public service, their resilience, changing duties and shifts at times at very short notice, putting themselves in harm's way if necessary, to help others, to keep people safe, to protect the health service. Police Scotland will continue to do everything we can to support and enable our officers and staff, so that they in turn can support the national effort and support our very close colleagues in the health service. Now, in responding to this latest lockdown, Policing, indeed society as a whole, is able to draw on the experience of late March and April, a very intense time in the early weeks of the first lockdown, when unprecedented changes were made at pace. I'm very clear in my own mind that the benefit of our single national police service in Scotland, able to assess need and quickly deploy resources to meet those needs, wherever they arise across the whole of Scotland, is increasingly clear, enabling a rigorous, consistent and effective policing response. But of course we need to recognise that the significant sacrifices and changes to daily life, including policing, will not be without consequence. In this regard, as the First Minister has underlined very clearly this morning, and as I have repeatedly, our concerns remain about the impact of these restrictions for people where home is not a safe place to be. As the requirement to stay at home becomes more acute, so does our concern. Victims of domestic abuse, vulnerable children, vulnerable adults, they're a priority for the Police Service of Scotland. They go to the heart of our purpose, the heart of our mission, and will continue to work very, very closely with all our partners in local authority and in the third sector to make sure that protection is there, support is there at all times for people who are vulnerable to abuse, harm or neglect, whether that's in the private or indeed the virtual space. So I would urge anyone, everyone, with concerns about another person, a relative, a friend, colleague, neighbour, contact the police. We are here 24 hours a day, every day. The Police Service of Scotland is there to help you. As we now enter another difficult period of lockdown, my priority, as always, remains the safety and well-being of everyone in Scotland. Policing is committed to supporting and ensuring everyone sticks to the rules to prevent the terrible harm and death that can arise from this virus. Please take care of yourselves and take care of each other. Thank you.
Many thanks, Chief Constable. We'll now go to questions from journalists. Let me just repeat what I said at the start. We have been having some technical issues this morning with the links to journalists, so hopefully they'll all be able to join us and ask their questions, but if there are problems, we'll navigate our way through them as we go. But firstly, today, Andrew Kerr from the BBC.
Thank you, First Minister. John Swinney was saying this morning that more people are moving around now than during the spring lockdown. Do you feel people are obeying the instructions, and where are further restrictions perhaps needed? To the Chief, is a new approach indeed needed? And just finally, tomorrow, hundreds of untested football players will travel up and down the country to play in the second round of the Scottish Cup. Should this be allowed to go ahead, and is it a risk? Thank you.
OK, of course there'll be no spectators in football, but I'll hand over maybe to Jason on the football point, as he's been closely involved in discussions with the footballing authorities, and I'll ask the Chief to address the question to him. Very briefly from me and John Swinney's remarks this morning, I think anecdotally there is a sense that people perhaps are still moving around a little bit more than was the case before in the first lockdown, and I've sort of reflected on that once or twice already this week. That said, it can sometimes take a few days for people's working arrangements to change. We're looking quite closely at traffic flows. First week in January is perhaps not the best time to be comparing, this week's traffic flows to last week's, because of course we had holidays last week. So there's a bit of uncertainty right now, but and we'll be considering that over the next few days and considering whether any other restrictions are required, just to make sure that this lockdown is effective as it needs to be, because it needs to be effective. I have spoken previously this week about the kind of areas that we're looking at. For example, do we need to restrict services like click and collect a bit more? Not suggesting that we would stop people doing that for essential services like food, but for non-essential shopping, do we need to restrict takeaway services a little bit more so there are fewer places staying open? Non-essential construction, for example, is another area that we're looking at. And also, are we getting the message across loudly and clearly enough, and do we think that it is being heeded enough that people should be working from home and that employers should be facilitating home working as far as possible? So these are the areas we are considering. We haven't reached decisions yet, and my message to everybody is please respect this lockdown with the same seriousness you did last March, April, because it is as serious now. Indeed, you could argue that with the faster spreading strain of the virus, it is even more important that we all respect the lockdown. So that is a message to individuals: stay at home unless your reason for being out of your house is genuinely essential. And secondly, to employers, if you had staff working at home last spring and you're asking them to come in right now, you shouldn't be. You should be asking yourself why that is the case. Instead, you should be facilitating home working. I'm sorry if that sounds pretty harsh, but that reflects the severity of the situation we face right now. If we feel we need to put any more of that on a legal, regulatory footing, we will do so, because we cannot afford to have restrictions in place right now that are not operating effectively enough to stem the flow of this virus. I'll ask Chief Constable if he wants to add anything to that before asking Jason to say a word about football.
Thanks, First Minister. Thanks, Andrew. What I would say about the approach of policing in Scotland is that we've been consistent from the outset. It's not a matter of whether we've got a light touch or whether it's heavy-handed. What I've looked for is proportionality and consistency. So I think in the early days you've seen some instances in other parts of the United Kingdom where there was almost a knee-jerk in terms of enforcement. And then there was a backing off, potentially, and now we hear language of we need to up our enforcement. Actually, in Scotland, we've been consistent. So I gave some figures earlier when I mentioned that we'd issued over 7,000 fixed penalties after having 100,000 interactions with citizens. So by way of comparison, the regulations are different but very similar. Metropolitan Police with a population of around 9 million compared to Police Scotland with a population of 5.5 million in a very urban area, had issued less than 2,000 fixed penalty notices compared to the 7,000 we have issued. And yet that level of enforcement is still a very small proportion, at 7% of the amount of interactions we've had with our fellow citizens, because we're visible, we're out in our communities, we're engaging with people, we're explaining things. And we will take enforcement action as the regulations change. We will take enforcement action when required. So I am satisfied that what I laid out at the outset about using common sense, using proportionality and exercising discretion, that will continue. But make no mistake, if we need to take enforcement action, we will. And I am more than satisfied with the approach that the Police Service of Scotland has done thus far in support of this public health imperative.
Thanks. And briefly, Jason, on football.
So professional sport, as we've mentioned many times here, is exempt from the travel restrictions for the purposes of training and participating. So footballers can move around the country tomorrow with their club doctors, with their management. However, they must have very strong mitigations in place to do so, both for travel and for then competing. I would expect their numbers to be minimal, so they keep their support staff to the lowest level possible. And remember, the exemption to distancing and face coverings and all the other elements that the rest of us have to face are across the white line, not on the other side of the white line. So for now, professional sport remains exempt and they can travel, but they have to still be careful. Some of them may have the virus and they should behave as though they have.
Two final points from me on football, which I think everybody probably gathers from now by now is not necessarily my favourite subject to talk about, but the exemptions for professional footballers and elite sports people generally are not just for their benefit. We're trying to give the general public, and many people in Scotland love the football team and love watching football. So we're trying to give people that bit of entertainment, that bit of normality. So it's for your benefit, not just their benefit. But the second point I'd make is this, and it applies not just to football, but to any sport. If whatever sport we're talking about doesn't stick to the restrictions and doesn't make sure that all the mitigations are in place and that what they are being allowed to do, and it's a privilege, is done safely, then all bets are off. We will have to look again at that, and we cannot guarantee that we will not have to change this in future. So, to the sports people involved, and I'm deliberately saying sports people and not focusing this entirely on football, but you are being given privileges at the moment, so make sure you don't abuse them and that you are absolutely rigorous in applying all of the restrictions that still apply to you, even within these privileges. I'm told that Gordon Cree from STV, unfortunately the technical problems mean he's not online. If that changes before the end of the briefing, we will try to come back to him. I'll go next to Bruce Mackenzie from ITV Border.
Thank you, First Minister, and I'm sorry to stay with football, but today I've been speaking to one club, Dalbeattie Star, who play in the Lowland League, who say that as far as they're concerned, that league should be halted at the moment. They say their players who are part-time players are very, very worried about the possibility of transferring the virus, possibly over hundreds of miles as they continue their fixtures. They say that they're making representations to the league, asking for the league to be halted, but if they don't play their games, there will be repercussions on them as a club and they might be punished. Should the Scottish Government maybe be calling for, certainly at the lower levels of Scottish football, these leagues to be suspended, even for a fire break of a few weeks?
So that is certainly something we will continue to discuss. Jason may want to say more about that. I suppose what I would say, the footballing authorities, to use the sort of collective term here, have been very keen to get football restarted and then to keep football going, and that, for the reasons I've set out, I think is something that many people across Scotland are keen to see continue. What we don't want to do in any walk of life, whether it's somebody being asked to go into a non-essential workplace or a footballer in the lower leagues being asked to play, if people don't feel comfortable about that and they don't feel safe, then that's something we've got to listen to, and the footballing authorities have to listen to as well. So we will certainly continue to listen to those kind of concerns. But Jason, do you want to add?
I agree on the safety point. If people don't feel safe, they should raise that up the chain, and that chain might well end up at the SFA and the SPFL. At the beginning of these restrictions, we had long conversations with the SFA about what professional football meant and the 7 tiers of professional football that takes us down into, for instance, the senior professional women's game at one of those levels. So those 7 groups were included in the restriction allowances, let's call them. So if that remains the case just now, but we and the football authorities are in constant communication, and if that is a common approach, a common feeling from that part of the league, then of course the football authorities should take account of that. But those decisions are for them, not for us.
Fraser Knight from Global.
Thank you, First Minister. Earlier this week, you talked about the potential of fast-tracking the vaccination for teachers and for staff in schools and potentially colleges. We obviously know that some of them are still working in hubs, and today we've heard that the Moderna vaccine's been given approval in the UK, and the Welsh Government's just announced that they will be extending vaccination to staff working in special schools, school and college staff who are at risk, in line with latest advice from the JCVI. Just wondering what the latest discussions are in the Scottish Government, and could this potentially be delivered in, say, the next week or the next 2 weeks to some teachers?
So a couple of points, well, 3 points I think briefly Jason might want to add to this. Firstly, it's good news that Moderna has just been given authority in the UK. That's the 3rd vaccine approved in the UK, although we're not necessarily expecting immediate supplies of the Moderna vaccine, although that is subject to ongoing discussion, I know. Secondly, as I understand what the Welsh First Minister has just announced, it is not a decision to prioritise teachers within the current priority list. Teachers or staff within special schools, as I understand it, would potentially already be covered within the social care workforce. So that is what we will look at to cover that workforce as well, and as part of the NHS and social care prioritisation that is already within the JCVI list. But the 3rd point is this: the JCVI list is the people, and in order of priority, and ultimately this prioritisation list takes in about 2.7 million people in Scotland, about half the population, everybody over the age of 50 and everybody under 50 with underlying health conditions. And it starts at care home residents over 80s, NHS and care staff, and then works down the age spectrum. And basically, these are the people that are most clinically at risk of getting ill and dying if they get this virus. And I was looking at some statistics earlier this week that show, demonstrate this by saying how many vaccinations in each of these different groups you have to do in order to save a life. So if in care homes, for every 40 odd vaccinations that are done, you're saving a single life. The further down the list you go and into the general population, that becomes hundreds or thousands of vaccinations to save a single life. So that underlines the clinical priority. It would be unethical to divert doses of the vaccine from those most clinically at risk into any other group at the moment. But what I said earlier in the week, which is what we're doing, is once we have done the JCVI list, or if we get more supplies than we are expecting, how soon can we start to prioritise teachers as we consider the wider vaccination programme. So we are continuing to discuss that, to consider that, and want to get to that position as quickly as possible. But it would not be ethical to take vaccine from somebody who was at very high clinical risk of dying or becoming very ill to somebody else who is much healthier and at less risk, whether they are whatever profession they happen to be in. So these are the considerations that the JCVI advice is based on, and it's important that we take that advice. Scottish Government has never departed from JCVI advice. In England, that advice is statutory, but we treat it almost as if it is. I don't know, Jason, whether you want to add to that briefly.
Only that the Welsh position is as you outlined. The Welsh are not departing from JCVI advice, they are following it. And there are some very, very unique settings in special needs schools where they are social care workers, in effect, where mitigation is impossible, where distancing is impossible, etc., etc. And we will look and do the same if we possibly can. The other point is that on the 8th of January, the JCV advice is to save lives using that age-related table. As we get hundreds of thousands of people vaccinated, that begins to change the equation, because that's about population protection. Just now, this is all about individual protection for people, and that's why the JCVI have told us to do this. And very finally, we will get a lot of teachers during the priority process. So a lot of teachers are over 50, a lot of teachers were shielding, and a lot of teachers have pre-existing conditions. So as we go down, we will capture a lot of the school staff and early learning staff.
Neil Pooran from PA.
On that, does that mean then if teachers are fast-tracked, or as potentially as you were saying, that they would have to wait until we've gone through all of the kind of phases of the JCVI list that essentially be at the bottom of that before the general population?
What we said is the JCVI list has to be the priority for the reasons we've just set out, because if we don't do them as a priority, we are leaving people, when we've got the alternative, at greater risk of dying. But if you're a teacher who's over 50, if you're a teacher who has an underlying health condition, you are in that list, and it would be wrong not to give you that priority. But if we're to take, say we were to put any professional group, I don't want to focus this on just on teachers, any professional group above one of the JCVI priority, what we'd effectively be doing is taking doses of vaccine from older, frailer, sicker people who might die if they get this virus, and potentially giving those vaccines earlier to young, fit, healthy people who, if they get the virus, I'm not saying it is nothing to worry about. You've heard me say many times that nobody should be complacent about this virus, but people who are at a much lower risk of becoming ill and dying. So that's why this clinical advice is as it is. But I want to, as quickly as possible, vaccinate the whole population. And as we get to a point where we are getting beyond the clinical priority groups into the wider population, yes, groups like teachers are definitely what we want to try to bring forward as much as possible. And that's the sort of consideration that I indicated we would be having earlier in the week, and that's ongoing. Neil Pooran from PA.
Thanks, First Minister. On the requirement for international travellers to have a negative test result before they arrive, can I ask why this requirement wasn't introduced earlier, given that we've known for some months now how important the role of travel is in spreading the virus? I think some other European countries have already had a requirement for a negative test pre-flight for a while now. And also, after the travellers arrive, can I check if every traveller will be contacted by the authorities to ensure that they're sticking to the quarantine requirements?
Well, the reason, I mean, you can argue we should, on all sorts of things that we're doing now, we should have done it earlier, and that's perfectly legitimate. And in some of these instances, there will be a good argument that we should perhaps have done certain things earlier than we're doing it. But we are where we are. We have relied on quarantine previously, and the arrangements around quarantine where everybody gets an email, and then there will be a percentage of those people followed up by Public Health Scotland with the ability of enforcement action if that is necessary, that will continue. The other thing about pre-departure testing is we've been very keen to do these things on a four-nation basis, because it will be border force that, of course, it has to check those coming into the country in terms of have they had the required tests. So this will be a system that works. People will have to show the evidence of their test before they start their journey. So, you know, air carriers will have a role to play here, but then coming into the country, it will be border force that is doing the checks. Border force, of course, is reserved, and therefore I think it is positive that we are now moving forward on a proposal like this on a four-nations basis. Derek Keeley from the Courier.
Thank you, First Minister. I know we were previously able to build up some kind of picture of where people might be picking up the virus based on interviews with contact tracers. With rising cases to above 2,000 a day, 2,000 each day now, is there any kind of picture yet of how and where that increased transmission is taking place? And if I may, Boris Johnson has promised to vaccinate the 4 top priority groups by February 15th. I wanted to clarify, because I've seen some confusion over this. Do you expect those 4 groups to be vaccinated by the same date in Scotland as well?
Well, I've covered this already this week. If we have the supplies to do it, then yes, we will want to do that as quickly as possible and within these kind of timescales. But I'm not going to stand here and give, I said yesterday, that the over 80s will be done over the next 4 weeks. We're almost through care homes, well over half the way through care homes, and that's rising all the time. But I'm not going to stand here and give hard and fast commitments before I am sure we have the supply assurances. I later today have got a session with our vaccine team in here to get the up-to-date information on supply, on the arrangements in place. So we will give commitments as soon as we feel we are able to give them with the certainty they require. But we absolutely want to get everybody on that list vaccinated as quickly as possible. I'll hand over to Jason briefly on your first question. Look, when you've got low prevalence and you're dealing with outbreaks and flare-ups, then that picture of where are these flare-ups happening, where are the outbreaks, so that you can look to see whether there are any mitigations. The contact tracing teams still do that, so Jason may be able to give a bit more on that just now. But when you've got higher prevalence, then the virus is circulating more generally. So literally right now, this virus will spread wherever people are coming together. So in a sense, it doesn't really matter right now where that is. It will spread when people come together, which is why we are back at a situation where the advice is very, very stringent and very tough. Stay at home unless you have an essential purpose to be out. And that's because that level of community transmission right now is as high as it is, and we need to stop it increasing and then get it down.
The tricky thing here, as we've talked many times here, is the question that contact tracers ask is, where were you 48 hours before you first developed symptoms? So it's about location. You can't tell that's where they got it or where it was passed on. It's just about activity during that 48-hour period to try and give us some understanding of where the risk is. And you won't be surprised that in the last 7 days that is shops, houses and visiting friends or family, some of which will be for essential reasons, some of perhaps might not be for essential reasons, hence the reason we've introduced a stay-at-home law. There are other things in there. There is car sharing, there is going to places of worship, so everything that people do by interacting is risk and comes up in that report. The other place we get this data is from outbreak management reports. That's where we get bigger numbers. So that could be workplaces, that could be care homes, that could be inside our hospital system. And again, that continues to show that same pattern. Following community transmission, those places are harder to keep safe. So the same things apply. Whenever people meet, the risk is there.
Conor Matchett from the Scotsman.
Thank you, First Minister. On hospital capacity, if I may to start with, for either yourself or Professor Leach, whoever has the data handy, have any health boards breached their winter capacity for COVID-19 beds as yet? And if not, are you concerned whether any will do so in the coming days? And secondly, to follow on from Derek on vaccines, I know you said yesterday there are no plans to publish the level of supply for the vaccines. But in order for the public to be able to hold yourself and the government accountable for any potential delays to any potential targets, surely that data has to be published for transparency purposes. And in a similar vein, are there any plans to release the number of vaccinations by vaccination centre, such as GP surgery or village hall? I assume this data would be available to Public Health Scotland in their standard collection. So I'm just wondering whether or not that would be published like neighbourhood COVID-19 cases are.
Undoubtedly, I'm not going to go over all of the explanations I gave yesterday on this because I went into some detail yesterday. Undoubtedly, just as if you cast your mind back to the start of the pandemic, there's stuff we publish now that we didn't publish at the start. There's stuff we published at the start that we now publish on a much more granular basis. So just in the last couple of days, Public Health Scotland have given more information that allows case numbers to be broken down at a much more regional basis. So just because we start off on a certain level doesn't mean we don't build up overall. There will be some good reasons why certain information shouldn't be published on a daily basis for all sorts of reasons, and I gave some of that yesterday. And to be frank, I mean, you say, well, surely Public Health Scotland gathers it. For Public Health Scotland to hold any information, it has to gather it from the people doing the particular activity. And that is something that then takes those people away from the activity that they're doing to gather and feed in the information. Information is really important. Transparency and reporting is really important. But as the person in overall charge of making sure this response is doing everything it has to do, we have judgments to make. I have judgments to make about the number of hours in every given day that we're asking people to gather data and report data versus what we're expecting them to do. So we will continue to try to reach those judgments properly. We'll start with daily reporting of vaccination next week. The weekly reports will become much more detailed, and then we'll no doubt build on that from there as the programme gets up and running. And forgive me, your first question was on hospital capacity. I'll hand over to Jason. So if you look back earlier this week, you had Greater Glasgow and Clyde managing patients across their different hospital sites. That is not, by any stretch of the imagination, unheard of at times of winter pressure. So they have managed to do that. They haven't run out of beds. No health board has run out of beds in that way, but they are all, nationally we have hospital occupancy with COVID patients above the April peak. There are some health boards that have been above that peak for some considerable time, and many health boards now are operating at a very high level of occupancy, which is an indication of the pressure that they're under. But Jason, do you want to say any more?
Yeah, so we haven't run out of beds, so people should be reassured that the health service remains open and available to you. If you have a stroke or a heart attack, we are there for you, and if you have COVID, we are there for you. But for planning purposes, we have to, of course, think with the health boards, how many beds should we reserve for COVID? And that changes over time, but it has a cost, because if we reserve the beds for COVID and fill them with COVID cases, it may mean elective surgery, planned surgery stopping. And we are having to do more and more for COVID, and therefore stopping some elective surgery. Dumfries and Galloway, just in the last few days, has begun to reach what looks like a point at which they would have to stop doing more elective surgery than they would otherwise want to. So we have capacity, but as the First Minister says, that capacity sometimes needs moved around the country, moved around health boards, and we will continue to do that as the winter goes on.
Tom Martin from the Express.
Hi, thank you, First Minister. Today's daily fatality figures are the highest we've seen of the pandemic so far, sadly. How prepared should the public be to see the situation get worse before it gets any better? And secondly, if I may just briefly return to the pre-departure testing. You mentioned it was likely to be PCR tests you would be looking for. Is that going to be the same standard amongst all the home four nations when this is brought in? And what sort of work's underway to sort of guarantee international standards?
I can come back to you on the point of any work that's underway to agree international standards. All countries will be taking their own decisions around the testing regimes they have in place. But yes, we would intend to get to a position within the four nations where the testing that we are requiring for the pre-departure tests are the same. And they need to be highly specific and highly sensitive, and that is PCR testing. There are some debates around certain other type of tests that may or may not meet these criteria, and those considerations are ongoing. On numbers of people dying, Jason may want to add something to this too. Firstly, on today's figure, which is a distressingly high figure, And what I'm about to say doesn't change that and is not intended to change that in any way. But of course, we have just come out of a period when we've had the Christmas and New Year bank holidays. And remember, the numbers we report on a daily basis are deaths by the date the deaths were registered, not the date that somebody died. They are reconciled later on by date of death. So the high figure that we've seen today will undoubtedly include some people who died over the Christmas and New Year period, and the delay in registration because of the bank holidays means that their deaths are only being reported today. So that is not, just to be clear, it's not more than 90 people who died yesterday. It will be more than 90 people who have died over a period of time. That doesn't change the fact that they are all individuals who have died, and they have died as a result of COVID, and it is deeply distressing. But the last point I'd make before handing over to Jason is, as we have learned, unfortunately, in the course of this pandemic and the way viruses work, we do know that even when case numbers start to reduce, and I hope we will see case numbers stabilise and reduce over the next few weeks in Scotland. But even when that starts to happen, because of the incubation period and the time it takes for people who get this virus to show symptoms, and then if they're going to become ill, to fall ill, and then unfortunately if they're going to die, it means that even when case numbers start to decline, we still see potentially an increasing number of hospitalisations and deaths for a period after that. So that will undoubtedly, from the case numbers we're seeing right now, we are unfortunately going to see a significant number of people needing hospital and intensive care treatment in the weeks to come, and unfortunately a number of people dying from that, and that will, I know, be distressing for everybody.
Yeah, so I completely agree. The deaths today is an astonishingly difficult number to both read out and to apprehend and to comprehend. The difficulty with the data is that we need to wait for that to even out to date of death, and that will come over the next few weeks, but it is still a hugely significant number. This is 2 weeks exactly since Christmas Day today, so we probably have most of the positive cases from interaction on that day, although these people probably got symptoms a few days ago and tested a couple of days ago and then reported today. So we're not completely out of the Christmas Day numbers. But remember, Christmas Day interaction is not the only problem. Interaction subsequently, when you didn't know you were positive, is the problem. And that's where the R number becomes important with the new variant. So if people have caught the virus on Christmas Day and then interacted further with people following Boxing Day, despite advice, that's when the numbers will begin to increase again. So I'm afraid the First Minister is right. It is going to get worse over the next little while, potentially before it gets better. 2,300 cases today, 2,300 cases odd tomorrow. In 10 days' time, that will be hospitalisations. In 3 weeks, 2 to 3 weeks' time, that will unfortunately show in the mortality figures.
Okay, I have an indication that the next two journalists on my list have, I'm afraid, fallen victim to the technical challenges. That is Tom Gordon from the Herald and Michael Blackley from the Daily Mail. I'm going to, at the end of these questions, come back and see whether any of these journalists that we've not been able to go to have managed to connect. I'm seeing Michael Blackley on the screen in front of me now. So Tom Gordon, apologies, I'm not going to come to you just now, but we'll come back and see if you're on later. But I do see Michael Blackley on the screen, so I'm going to check whether he can make himself heard. Michael?
Thank you, yeah. A few technological problems. Can you hear me okay?
Yep.
Yeah, so I just wanted to check with you regarding, I've had some contact from a district nurse who raises concerns about the fact that they're seeing increasing numbers of patients now, but yet they're not being treated in the same way as frontline NHS hospital workers in terms of getting the vaccine. So could you provide a bit of clarity on when district nurses will be able to receive the vaccine, given that they are seeing a lot of vulnerable people in their homes? And also, could I check with the Chief Constable, do you think that your frontline officers should be a priority group and get earlier access to the vaccine?
Okay, I'll hand over to Jason in a second and then to the Chief Constable. All NHS staff are in the priority group for vaccination, and we are well through that. I think getting close to halfway through the NHS workforce and social care workforce. So district nurses will be included in that, but I'll hand over to Jason, who will say a bit more about the prioritisation within that. And I'll then hand over to the Chief Constable. The only point I would make on that is all my comments about the importance of the JCVI clinical prioritisation stand, but so do my comments about teachers in relation to police officers. Any police officers who are over 50 or who have underlying health conditions will be in the clinical priority list as set by the JCVI. But firstly, Jason.
Yeah, very quickly, district nurses are in that first priority list of all health and social care workers. Remember, Pfizer was a slightly complex vaccine to give out, and therefore was easier when you had hospital staff all in the one place and we could use it from the freezers. Slightly more difficult with that more disparate community for district nurses, but you haven't been forgotten. You will be vaccinated in that first priority group, made easier now by the AstraZeneca vaccine.
Chief.
Thanks, First Minister. Michael, thank you. There is lots of concern within the ranks and within the service. Police officers, police staff, as you might imagine, alluded to earlier, that they are people with families as well. But I do think it's really, really important for us all to understand the clinical advice that the First Minister and Professor Leach have outlined today. The major purpose of vaccination is to get the biggest return for that, protect the most vulnerable. We've been discussing the concerns of policing with officials, with ministers within the Scottish Government, with colleagues in the health service, and I think it is on all fours with teachers. We need to realise that there's a recognition of the need and the anxiety within policing, but actually vaccination has to go where the clinical advice and the clinical guidance leads. I'm fully supportive of that, and what I need to do and I will undertake is to make sure that in terms of our personnel records, the knowledge of our own people, our availability, that when and if vaccines become available, if it is based on sectors, if that should happen, if it comes to policing, that we're in a position to make sure that we can get our officers and staff vaccinated. And the final point, just to reiterate that key point, that actually, of course, within the police officers and staff of over 23,000 people, a number of us will already be part of the prioritisation that comes from it. So there are concerns, there are legitimate concerns, working very closely with the Scottish Police Federation and others in that regard, but we're speaking to government. They know our concerns, but the clinical guidance has to take primacy.
All of these concerns are perfectly legitimate. I fully understand them. The final point for me is, remember, this is a vaccination programme that will reach everybody in the adult population. It's not like the flu vaccination programme where it is only certain groups who get it. This one is for everybody. But while supplies are limited and are coming in a phased way, we have to prioritise those most at clinical risk of this virus. But I absolutely understand the concerns of teachers, of police staff, people who work in frontline public-facing jobs. But so too do I understand the concerns of people who work in supermarkets and in other places where there is that public-facing element. So the priority for us is to get through the whole vaccination programme as quickly as we possibly can. Dan Sanderson from the Telegraph.
Thanks, First Minister. Yeah, just to follow up on that, on the vaccine rollout, can you confirm whether you're looking at a sort of 24/7 delivery of the vaccine when supplies allow? I know there was some concern in England that vaccines weren't going to be delivered to hospitals on a Sunday, so I just wondered whether we might see similar issues here. And also, could I ask the Chief Constable, quite a disturbing videos emerged on social media of an incident in Aberdeen where police are called to break up an alleged breach of COVID restrictions. It quickly escalates. There's physical confrontation. You hear children screaming in the background. Is this type of thing the sort of proportional and consistent approach you've spoken about? I know you're concerned that this could undermine confidence in the police. Thanks.
Okay, I'll hand over to Chief Constable on that. It's a matter that I understand is sub judice, but the Chief Constable will want to address that. And this comment is not directed at that particular incident, but more generally, that I think all of us these days know that we have to take some care when we're looking at things on social media, and just remembering that things often do not look exactly as the reality is with a whole host of things. On the point about vaccination, we'll do whatever we need to do to get this vaccination programme rolled out and completed as soon as possible. At the moment, we are focusing on the upper end of that prioritisation list. I said yesterday 1,100 vaccination sites. The majority will be GP practices, but other community vaccination centres will be operational from next week. When we have a volume of supplies that enable this, we'll have some mass vaccination centres as well. And we will, as we know more about the forward supply schedule, we will consider hours of working, to do everything that is reasonably possible to get this rolled out as fast as we possibly can. But Chief Constable.
Thanks, First Minister. Thanks, Dan. I think again I'm aware of the tweet or the piece on social media that people are looking at and commenting upon. I'm limited in what I can say in terms of the detail. What I can say to you is certainly last night and this morning I've asked for a review of the full circumstances to be carried out, and I've been briefed on the full circumstances, and as things stand at this time, I'm satisfied about the legitimacy and the proportionality of the police response. Now, the matter, as I said, is sub judice, but what I can say is that on Wednesday, late on Wednesday evening, the 6th of January, almost around 23:30 hours, police did respond to concerned calls from members of the public about what appeared to be an ongoing house party. Officers then attended at the address that had been identified and at that time spoke to the occupants. Now, what's come out of those circumstances is that 3 adults have been charged with crimes of violence and crimes of public disorder. I can't comment further because of that matter. The matter will be reported to the Procurator Fiscal and due and legitimate process it will take its course. However, what I can say is 2 further points. The first one is I would urge everybody to exercise caution when you see a partial coverage of a particular incident. Do not read into things that you can't see, and do not make inferences that are not clearly there. I don't think it's fair to everybody involved, and it then does generate concern, which may not be legitimate. And the second point, I would say, sorry, just before I finish that point, I've also been told that the officers involved, some of the officers involved, actually had body-worn cameras with them, and they had been activated. So there will be a broader record of the full circumstances of that incident, and again that will be part of the due process that needs to take place. And then my second point and my final point is that I've said right at the outset, and I think if you go back to March, April, I commissioned John Scott QC, a leading human rights lawyer, to establish an independent advisory group to oversee and review the use of police powers, because this is a really, really challenging time for policing. The amount of circumstances that arise, the amount of people who are refusing to comply with the regulations, people who don't believe actually that the coronavirus is a threat. So as a result of that, John Scott has a highly prestigious group of individuals who will review circumstances, review our approach, and when need be, review specific cases. So I have asked John Scott QC and his independent advisory group to review the circumstances of the incident in Aberdeen to provide that independent oversight, as well as the report that has gone to the Crown.
Thank you, Constable. Dan Rivers from The Sun.
Thank you, First Minister. Good afternoon. You've highlighted today that the numbers in hospital with COVID now exceed the April peak, but as we know, there are also not insignificant rates of people catching the virus in hospitals, nosocomial infections, with nearly 200 in the last week that we have data for. Do you have any idea how many of these 1,530 people, I think it was, in hospital you mentioned today, who were already in hospital when they caught COVID? And is there an argument for splitting those figures? And just to the National Clinical Director, I just want to pick up on something you said to the COVID committee this morning. You said the guidance that the 2 vaccine doses should be from the same manufacturer will remain in place for now, but could change in future pending trials. Can you tell us a bit more about what those trials underway are doing? And can you understand, given the change to dosing guidance we've seen already, why talk of a further change like this might make some people uneasy. Thank you.
I'll hand over to Jason on the second point. On the first point, and Jason, we want to say something on the first point as well. And my apologies if I've misunderstood your question and the answer I'm about to give. But we publish every week. In fact, the Sun, I think, did quite a big feature on this week's report earlier in the week. Nosocomial, a report on nosocomial infection. Nosocomial infection is hospital-acquired infection. And in that, the total numbers of people in hospital with COVID, it is broken down into the cases where it is thought it was definitely acquired in hospital, cases where it is assumed or thought likely that it was acquired in hospital, but it can't be definitely established, and then cases where patients have had COVID in hospital, but the likelihood is that they brought it into the hospital because they had acquired it in the community. So if your question is, can we break that down, that is broken down. There's a bit of a time lag on these statistics because of the work that has to be done to effectively establish which category these cases go into. Nosocomial infection is something that everybody associated with the health service takes incredibly seriously, and that's not just something that arises out of COVID. As I frequently reflect on, spent many years as health secretary, and at that time, infections like C. difficile and MRSA were of huge concern. So infection prevention and control is a significant priority in hospitals at any time, and obviously with a virus of this nature now circulating particularly so. I think the report that your newspaper did this week was that in this phase of the virus so far, there have been a higher number of patients, either definite or probable hospital onset of COVID, than was the case in the first wave. That is true in terms of absolute numbers, but as a proportion of overall cases looked at, it's actually still a smaller proportion. But any person that gets an infection in hospital is something that is deeply regrettable, and those working in hospitals try very hard to minimise. But as is the case in care homes and hospitals, in any institution, the level of infections we see in our hospitals will to some extent be reflective of the overall community transmission, which is why in so much of these discussions, what it comes back to is the need, the collective need we all have to get community transmission down as far as possible. I'll hand over to Jason to see if there's anything he wants to add on that, but also to answer the question specifically to him.
Let me start by thanking the army of infection control nurses and doctors around the country who every day are fighting to get that number as low as they possibly can in a really, really difficult environment with large numbers of community transmission cases. We have proportionately reduced that number compared to what is happening outside, and the biggest risk, people should be under no illusion, your biggest risk is catching this virus outside when you interact with other people. To the 2-dose vaccine question, it's not uncommon actually in vaccine science for a second booster dose to be an entirely different manufacturer to the first. We do that in hepatitis B vaccines for healthcare workers, we do it for typhoid, we do it for many others. We won't do it here until the science tells us that's exactly the right thing to do. Remember, you don't get Pfizer antibodies, you get antibodies. And we just need to check whether those antibodies continue with the second injection at the same level as they would if you'd got that. And that's what the research is doing. Quite simply, some people who volunteer will get Pfizer first, AstraZeneca second. Some people will get AstraZeneca first, Pfizer second. And they will check antibody levels over time to see what happens. It's as straightforward as that. But vaccine science quite often doesn't care about the company, it cares about the antibodies.
Mark McLaughlin for the Times.
Good afternoon, First Minister. I want to really turn to schools. The front page of the Herald today had a story about they're keeping the schools open for vulnerable children. This is an extension of the key worker idea, and they've also asked social workers to identify any vulnerable children who may be at home. Is that something you would advocate for all local authorities, that vulnerable children should also have a place in school alongside the children of key workers? And also, the other day, Carol Monaghan asked Boris Johnson whether teachers would be vaccinated before they went to school. She said that they are sick of being sent into unsafe environments. that doesn't sound likely in Scotland if we're going to get schools open by the 1st of February. So why is the SNP advocating something at Westminster but dismissing it at Holyrood?
Nobody's dismissing these things. I think anybody who listened to my answer on teacher vaccination, heard the Chief Constable about the same arguments about police officers, know that these are not being dismissed. They are absolutely being taken seriously. But we have limited supplies of vaccine at the moment, and therefore we have a duty, I think an ethical duty, as well as a duty from the point of view of protecting life and the health service, to vaccinate in the order of clinical need and clinical risk, and that's what we're doing. Within that, many teachers will be included, many police officers will be included, many people across society will be included. As I've said before, that whole list includes 2.7 million people in the country, and as we get more supplies, we then want to see how we can vaccinate particular professional groups, including teachers, as quickly as possible with as much priority as possible. That's the same position there is across the UK right now. I'm not sure I fully understand your first question, because it's been the case since day one of lockdown last year that vulnerable children were able to have a place at school, and we want vulnerable children where there is a considered need for that to be in school. So that hasn't changed between the lockdown last year and the lockdown this year. In terms of how local authorities deliver that provision, there is a degree of flexibility for them. Many local authorities will keep schools open to do that. In the last lockdown, many local authorities had hub provisions, and that is a judgment that local authorities make based on how they most safely deliver that provision for young people. But the position on vulnerable children hasn't changed. Andrew Learmonth from the National.
Clarity, First Minister. The question was, will teachers be vaccinated before schools reopen?
I don't think I can answer that question in the abstract, because when schools reopen, we'll take account of a whole host of different things, and when teachers, as a profession, many teachers will be getting vaccinated over the next few weeks as part of the prioritisation. But these questions can't always be answered in that very sort of binary way, unfortunately. The complexities of this virus and managing this virus are just a little bit more than that. Andrew Learmonth from the National, I'm told, is not online. Before I finish, because I've gone through everybody I think that is online with us, but Gordon Kieran, Tom Gordon and Andrew Learmonth, I'm told, weren't with us for technical reasons. Can I just check they're still not able to be with us? Okay, my apologies to any journalists who had technical difficulties joining today. We will, of course, be working to resolve them before the next briefing. That concludes all of the questions today. My thanks to Jason, and in particular my thanks to the Chief Constable. Always grateful to him for joining us, and that gratitude extends hugely to police officers and police staff working so hard across the country. Thanks to Yvonne for our BSL interpretation, and to all of you for joining. Please, this is the first weekend since the new lockdown started, so I don't expect it will be an easy one for many people across the country. Weekends are times that people like to do normal things like see friends and socialise and go shopping. None of that is possible right now, and I know how tough that is, but it is really important that we all dig in and stick with it over these next few weeks. So please stay at home unless you have an essential purpose to be out of your house. The safest place for you and the safest place for you to be to keep other people safe is in your own home. So please stay home, protect the NHS, save lives. That's the mantra all of us need to live by for this next period. Thank you very much. I will be back here on Monday at 12:15. But in the meantime, thanks very much for joining us.